In this video, I will demonstrate you the attachments of the ulna and also the relations of the ulna with the radius. In my previous video, I demonstrated you the general features, how to determine the side of the ulna, and what are the articulations of the ulna. Now firstly coming to the attachments, the posterior part of the superior surface of olecranon process receives insertion of triceps brachii muscle, whereas its anterior part is covered by bursa. The anterior aspect of coronoid process, where we saw in the lower part there is ulnar tuberosity, which receives insertion of brachialis muscle. The lateral aspect of the olecranon process and the upper 1/4 of the posterior surface of the shaft receives insertion of anconeus muscle. Now here there is a supiniter crest, which is a sharp crest running down from the posterior margin of the radial notch. This supiniter crest gives origin to supiniter muscle. We have already seen here the supiniter muscle. It arises from the supiniter crest. It spirals or winds round from behind, and its insertion will be in the upper part of the lateral surface of the shaft of radius. So that is origin of supiniter from supiniter crest, and its insertion will be into the radius. The medial margin of the coronoid process gives origin to the ulnar head of flexor digitorum superficialis in the upper part, pronator teres in the lower part. Also, the medial margin of coronoid process gives origin to flexor digitorum profundus. The medial surface of the olecranon process gives origin to flexor digitorum profundus and flexor carpi ulnaris muscles. The posterior border of the shaft, it gives an attachment to aponeurosis, a common aponeurosis, which gives origin to three muscles: flexor digitorum profundus, flexor carpi ulnaris, and extensor carpi ulnaris. Coming to the surfaces of the shaft, upper 3/4 of the anterior surface and the medial surface of the shaft gives origin to flexor digitorum profundus. And in the lower part of the anterior surface, there is origin of pronator quadratus muscle. Now coming to the posterior surface, there are three muscles taking origin from above downwards: abductor pollicis longus, extensor pollicis longus, and extensor indicis. Now here the margin of the trochlear notch gives attachment to the capsular ligament of the elbow joint. The anterior and posterior margin of the radial notch gives attachment to annular ligament. The ulnar tuberosity here gives attachment to the oblique core. The interosseous border gives attachment to interosseous membrane. The styloid process gives attachment to the ulnar polateral ligament. And the base of the styloid process here on the lateral side gives attachment to the articular disc of the inferior radioulnar joint. This will separate ulna from the wrist joint. So these are the main attachments on the ulna. Now coming to the main relations, if we see this is the radius and ulna together, and if we see these from the posterior aspect, in the lower end, we are seeing the posterior aspect of lower end of radius. There are 4 grooves from lateral to medial. If we see 1, 2, then the third groove is just oblique, just medial. It is an oblique groove just medial to dorsal tubercle of Lister here. And there's a 4th groove. Then there is a groove present between the head of ulna and the styloid process. So if we go from lateral to medial, the first groove here, just behind styloid process of radius, transmits the tendons of abductor pollicis longus and extensor pollicis brevis. Medial to it, the second groove transmits the tendons of extensor carpi radialis longus and extensor carpi radialis brevis. And his third groove, which is just medial to the dorsal tubercle of Lister, transmits the tendon of extensor pollicis longus. Medial to it, this groove transmits the tendons of extensor digitorum and extensor indicis. In addition, it also transmits posterior interosseous nerve and anterior interosseous artery. At the junction of radius and ulna here, there is a tendon of extensor digiti minimi, which passes, and then on the ulnar side here we saw there is a groove between head of ulna and stridor process, which transmits the tendon of extensor carpi ulnaris. So these are very important structures on the posterior aspect, mainly transmitting various extensor tendons and related with radius and ulna. Thank you.